This video aims to support the data governance teams to describe the intentions of COCONNECT and to support the approvals process. COCONNECT is a new UK-wide infrastructure supporting researchers to find and access COVID data at pace. Across the UK, data which can help us answer key questions about COVID-19 has been collected. Each time a patient has taken part in research, visited their GP or hospital, or taken a test, data is securely held by the organisation who collected it. Using larger volumes of data from different sources helps us understand the nation's health and COVID-19 status. It's difficult and complex for public health groups, researchers, policymakers and government to find and access lots of high-quality data quickly and efficiently to make decisions. If researchers want to access these datasets, there are lots of technical and governance processes to go through. These make sure people's privacy is protected and data is handled securely within the law. But these processes can take a long time to approve and put in place. Enter the COVID Curated and Open Analysis and Research Platform, otherwise known as COCONNECT. COCONNECT uses cutting-edge technology to support research quickly, whilst making sure people's information is kept private and secure. COCONNECT has patient involvement at the heart of its design. Our team of public members are directly involved in the project to make sure that the public's perspective is heard and acted upon at every stage. COCONNECT allows researchers to search and compare data across the UK through one website, the Health Data Research Innovation Gateway. Importantly, the data doesn't move from the partners who own it, and they have the final say on who can access it. Within each COCONNECT data partner, a secure computer is set up, which is separate from the location where identifiable data is stored. A copy of relevant data in a common format is transferred onto the computer without any identifiable information. This is known as pseudonymous data. For example, information like names, addresses, dates of birth, and specific dates of testing or care are removed. Before the data is transferred, the unique number for each person is converted into a new pseudonymous code by each partner. In our example, all that is transferred about Jane Doe is the pseudonymous code and that this person had a positive PCR test on the second week of August 2020. Software within the secure environment will send a message out to the gateway, which will return any questions which need to be run on the data. The software will return a summary answer to each question as the number of the people which meet the criteria, helping researchers discover the most useful data. In this example, there were 102 people in the dataset who have had a PCR test which was positive and were under the age of 40. To make sure people cannot be identified, each partner can set a threshold in which no results are returned. For most, this means only results with more than 10 people are returned. The same question is automatically run across all data partners providing the information from across the UK. The Gateway website and COCONNECT only ever see anonymous data and so will never find out who a person is. Not all questions can be answered by summary data. A future aim of COCONNECT is to support partners to automate the extraction of a pseudonymous subset of data relevant to a specific research project from each partner. This would require research project-specific permissions to be obtained and for the research to be within the public interest. The Gateway could support such applications in a standardised way across partners. The current plan is for extracted data to be placed into what is called a trusted research environment. Trusted research environments are secure IT systems that researchers can remotely connect to and ask research questions on pseudonymized data. The data cannot be copied or removed from the trusted research environment. Researchers can only export answers such as a trend or a graph. The COCONNECT architecture means that data transferred into the trusted research environment will have been cleaned and transformed into a common format prior to extraction. This common format reduces the amount of effort on each single research project, supporting rapid research to help the government and policymakers to take decisions. COCONNECT will work with all partners to understand how we can ensure an individual's data is given the same pseudonymous code across all partners. This will support linkage across the data about that individual. When data is extracted for a research project, the plan is that the pseudonymous code is converted into a unique identifier for that specific project. Researchers will be completely unaware of who the information is about. Linking data in this anonymous, safe way enables rapid, powerful research. For example, COVID-19 results from a test centre can be linked to hospital records along with prescriptions from pharmacies. By linking these 3 datasets, researchers can understand whether people with different existing health conditions are more or less susceptible to COVID-19 impacting healthcare treatments. The COCONNECT architecture supports all of this without individuals being identifiable. The plan will continue to be refined in collaboration with all the partners of COCONNECT. If you want to know more about COCONNECT, visit our website